starting the ERCP. Alberto Mariani is going to perform the examination. He's right in front of the papilla. We are giving a microphone to Alberto now. Alberto, can you hear me? Alberto, can you hear me? Are we ready?
Quite ready.
Okay. So Alberto,
Okay.
it's a tough case because we have a debate between a big mass in the gallbladder or a stenosis of the CBD right before the gallbladder and the mass in the gallbladder. So probably you are going to solve this problem.
Tonio, mi gira per favore la scopia.
You are facing a very small papilla.
Yes. Sotto sopra. Dall'altra parte, destra sinistra. Ok. Datemi lo sfinterotomo. Ok. Just a few minutes to prepare the devices.
So which are your steps, your scheduled steps for this patient?
I use a Boston sphincterotome with a guide wire 3.5 with a stride tip.
So we know from the US that the distal biliary common bile duct is not dilated.
Yes.
So.
E poi Buscopan. Guide wire, please. Okay. Buscopan, please. Okay. Guide wire, please. Okay. No? I am trying to cannulate the papilla using the guide wire. Stop. Tiriamo un po' il cavaliere. I try to correct the axis with the Coledocus. Tiriamo il cavaliere. Avanti il filo. No. Arco un pochino. No. Guide wire. No. No. It's difficult to obtain a better position in front of the papilla. The papilla is too far from an optimal cannulation.
This usually happens when you have big mass, which are
Yes.
keeping everything away.
Qui. Guide wire. No. Guide wire. No. Arco un po'.
Seems to be floppy. Seems to be
Yes,
floppy.
yes, yes. No. 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 Ok. No. Possiamo sproiettare, per favore? Arqui, arqui, arqui. Ok. Scoppia. No. It's very difficult to maintain a good position, good and stable.
And after how many attempts you think to change and go to a fistulotomy or pre-cut or something like that?
Not at this moment.
Not in this.
Stop. Arqui. Arqui, stop. Stop. No? Contrast, just a small pulse of contrast. Scopia. It's possible to change the angle of the X-ray, please? Probably in questo modo. Ok. Better. No? No, fermo col filo, Antonio. Abbiamo sempre la sovrapposizione di prima, eh? No? Provi così col filo piano piano. No? Bene. Contrast. Stop. Weer zo'n dat. Guide wire, please. Filo guida. Piano. Piano. Aspetta, aspetta. Ok? No. Guide wire. No. Now. Nothing. Guida. No. With the presence of a very small papilla, I prefer to avoid pre-cut. No? Arqui. Filo. No. Tenga qua, tenga su. Basta. Vada. No? Vediamo? No? I don't know. Contrast? Poco. Pancreas. Arco molto di più. Ok, arco di più. Arco. Arco. Top. No, 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 no. Piano. Arqui. Arqui, arqui, arqui. Stop. Rilasci poco a poco. Vediamo. Pancreas, vado. Sì. No, no. Dietro. Nothing at the moment. Archiamo. Arqui. Pancreas. Guide wire. Pancreas. Vado piano piano. Vado piano piano. Pancreas. No? Aspetta. Arco di più. Arco di più. Filo. No. Arqui. Fermo. Contrast. Versum. Always versum that. Vediamo di lasciare una guida lì se riusciamo. No? Dietro Antonio, piano. Provi adesso. Vada. Fermo. Stop. Vada. Ok. We put the guide wire into the pancreas. We leave the guide wire. I am going to try with a second guide wire to cannulate the common bile duct. Leave the guide wire. Okay. Change. Ok. No, un'altra guida.
Alberto.
Yes.
In these cases, you always try first the two guide wires technique and not performing the septoptomy.
No, I would prefer to use before the double guide wire technique. Okay. We are waiting for the second wire.
Alberto, do you want to give us It's obviously a very challenging procedure. Do you want to give us some tips on when you do the double wire technique, what you're aiming to do with the second wire?
Mi dà per favore? Mi dia. Tenga.
Alberto, can you hear me?
Non ho sentito.
Hello, Alberto, can you hear
Yes?
me?
Yes.
Hi. So it's Kofi here. It's a very, very challenging procedure. I was just wondering if you just give us your thoughts and sort of tips as you're doing the double wire technique, what you're aiming to do.
Now I put the sphincterotom just in parallel with the guide wire into the pancreas, and with the wire within the sphincterotom, I try to change the direction of the sphincterotom at 11 o'clock position, with the pancreatic duct occluded by the first wire. We are charging the guide wire into the sphincterotom. Dritta va bene. Quella che avete. Qualsiasi guida. The guide wire is passing into the sphincterotom. Qui. I try to change the direction of the sphincterotom, both seeing the endoscopic and the fluoroscopic image. Scoppia. Un po' di più, arcuiamo. Arcuiamo un po' di più. Stop. Andiamo. Guide wire.
Excellent.
Okay.
Nicely done. That's a very nice demonstration.
Guide wire. Pull the guide wire, please.
The X-ray image has gone very dark in the room.
Contrast injection, please. This is a common bile duct.
Are we able to adjust the image, sorry, for the cholangiogram? It's very dark. We can't see it very clearly.
There is a stricture where the gallbladder and assisting duct, I think, were inserted in the common bile duct. Scoppia? Non riesci a schiarire? Guide wire, please. Okay. Do you see the stricture or not?
I think we can, quite high up. It's a high up. It's a.
Sì. No, ma. Destra, sinistra? Ok. we have the stretcher. Do you see the stretcher?
Yes, we can.
Where the assisted DAT, I think, is inserted in the common by DAT. Now, guide wire, put the guide wire, please.
I mean, it all fits with the EUS image that James demonstrated.
Yes. Guide wire, please. Okay. Leave guide wire, please. See? Okay. And now we will do a brushing. Stop. Sphincterotomy, please. Okay.
So Alberto, now you will perform the brushing.
Yes.
Okay. We have already called for the cytopathologist, and then we will do the brushing, and then I think that we will end it up so you can put the stand afterward.
Okay.
Do you routinely have available on site cytopathology for brushings?
Yes.
Yes, we do always have cytopathologists for any kind of our biliopancreatic procedure.
That's great.
Non si arqua. Arqui. Doesn't work well, this sphincterotomy. Arqui. Si è rotto. It's broken the sphincterotomy. Ok, togliamolo.
This is the most challenging case
Yeah,
that we
yes.
had in these 2 days. Okay.
Yes. And now brushing, please.
Actually, we usually go with a Cook brushing, I think.
Yes.
Okay. As you can see,
And when it comes to putting a stent in, which stent are you going to use?
A metallic stent in a old woman, fully covered stent, metallic stent.
Yeah.
But we have to verify the proximal hand of the common bile duct to avoid the passage of the hilum using the metallic stent.
Yes.
I think that we have the space to place the metallic stent beyond the hilum. Below the hilum.
Yes, below, yes.
Below the
and
hilum.
Your pancreatic duct wire you've left in, are you planning to put a stent into the PD for pancreatitis prophylaxis, or will you just pull that out?
But I think no. In this case, I think no, because I have a complete drainage of the contrast minion by the pancreatic duct.
Yes, no, I agree.
We are passing the brushing catheter.
Just a question from Erwin. The patient will be given indomethacin, won't they? I think that's your unit policy. Do all the patients get given a non-steroidal for pancreatitis prophylaxis?
Yes, in all patients. Okay. Okay. We block the guide wire. We lock. Okay. Locked. Brushing, please. The assistant move the brushing. And we are checking the exact site of the passage of the brushing. Avanti. Okay. 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 The first passage. I retrieve the brushing catheter. Chiuda il brushing. Chiuda. No, prima, chiuda.
Ok, direi che possiamo. Alberto?
Yes?
Okay, we are continuously recording, and whenever you are ready, we will show up in the auditorium the results. So now I think that we can go on with the lectures and stay tuned, because sometimes we will go back. So Coffee,
okay.
You can go ahead with the lectures. Thank you.
See you later.
Yes, we do.
Okay. First of all, I need to thank Professor Doglioni for his kind words. We are proud to have him and his team working with us. So it's, we are really proud about that. But we are also proud, and I present you my team just at the beginning of this great work that we have these 2 days. So I need to present who is here now, because somebody has gone home. But this is part of our team of physicians, the physicians, and all our nurses, and we have our cytotechnicians here. So everybody is still here working, because we are going to take care of the patient that we have performed today. Everybody is well. Many of them went home, so I want to thank everybody for the great job that they have done. I need to remind you, maybe some of you do not know that yesterday there was a national strike in Italy, and we have been able to perform 15 live cases from here without any kind of problem, because many of our nurses, for their will to perform and to do procedures and to do the best for the patient, stayed to work with us. So I want for them a great applause from you. And obviously, And obviously, I want to thank all the IT team here for the big work that they have done. So everything went well, I think, because of them. So thank you very much, and see you soon next year. Thank you very much.